Within all of medicine is moving towards more subspecialty care. It's becoming more and more complex as we know more and more about disease processes. We have multiple providers providing a level of care that's just in their sort of subspecialty, whether that's sports or foot and ankle or hand and upper extremity, neuromuscular, hip, spine. And I think that's what separates us from a lot of other institutions. Kids have the ability to heal in a way that we don't as adults. With pediatric training, you realize that kids have the ability to take bones that are very crooked, that don't seem to be lined up at all, and then they can heal and remodel, and they'll be just like they were before. And so you're able to keep that kid out of the operating room, keep metal out of their body, keep scars from their skin, whereas in other situations, they may end up getting surgery that they don't necessarily need. And then if they do need surgery, we have the ability and the knowledge to do it as safely as possible to protect the growth plate. The ultimate goal is not necessarily to make the bone straight right now. The ultimate goal is to make them, have as normal arm or leg or spine as possible and to function. If a condition is particularly rare or complex, it becomes important to go somewhere where there's a high level of expertise in that area. Arkansas Children's has been known nationwide for high-level pediatric spine care for years. I would also say, brachial plexus injuries, particularly at birth, a lot of times they get better on their own, but when they don't, those patients need a place to go. You need people that are particularly well-trained and have the ability and the skill set to do that. And then also for limb lengthening or limb deformity care or specialized care for ACLs, like around the growth plate. We definitely want to be on the cutting edge of type of care we provide, but we also want to make sure we're providing as much evidence-based care as possible. We don't want to just do things because it's new. We want to do it because it's actually safer for the child and it provides better results. One of the things we have on the horizon is actually using more robotics in orthopedics, particularly in the spine realm. I think the other thing that's exciting is other ways that we can image kids and provide more specialized care, a more individualized approach to taking care of the injured patient with an ACL tear. And so we're in a multi-center group looking at how do we rehab these patients the best? What is the right time frame for them to return to sport? How do we prevent them from having a second injury? What I'm most proud of at Arkansas Children's is my partners. The training they have and their skills they have are second to none. One of the things that keeps me here is that camaraderie and collegiality among the subspecialties between, general surgery and ENT and urology and neurosurgery. Like, this is what academic medicine is supposed to be. People come together to try to figure out how to address a hard problem that doesn't really have a good solution. It makes it better for the patient that we can call and ask and say, hey, this patient needs more than just what I can provide them. Let's do this together.